I am 15 months on testosterone and 5 months post-op top surgery. That's an awesome feeling. Feels really good. Every day definitely gets better and better. I was having a few rough weeks lately. I needed to make some decisions and some changes for myself personally, and it's amazing once you start listening to yourself and make some of the necessary changes that you need to make for whatever is weighing you down. It's really incredible how much better you feel. So that was really good for me to make some good personal changes, mostly with work, and I'm feeling like a huge weight is being lifted off my shoulders. And I know that when I really stop trying to overanalyze and get myself like on the right path, then things just kind of fall into place. Really letting go and letting God is really the way for me to get more peace in my life, and that's been a really much needed feeling. So as far as changes, there haven't really been a whole lot, but I will say two definitely noticeable changes for me was the last time that I went and got my hair cut. I left, I always leave my sideburns, and my sideburns definitely this last haircut stayed way more filled in than they ever have. So I was really jumping up and down for joy because I was so excited that finally they weren't patchy and I didn't have to cut them off and just let them regrow because they looked silly. So that was definitely nice. The other thing that I noticed, especially within the last 2 months, is my hairline has definitely done the receding. So my last haircut, I was kind of freaked out because it looked a whole lot different than it ever has, just as far as really getting back there when I got it cut. So this last time I wasn't as shocked, but it definitely took me back. I think my girlfriend really laughed at me because I was freaking out thinking that she cut my hair wrong and it looked silly, but it was just, my hairline was definitely more noticeable. I used to have little like wispy things there pre-T, and now they're definitely just all gone. So those were two things that I definitely noticed. I am noticing some body changes as far as like fat redistribution and a little bit more like linear curves down where my hips are. So that's pretty fun to watch. I still need to get better at working out, but summer has been really hard having kids. We're very unstructured and just playing a lot of the time, so it's not as easy for me to get there to work out, but I know that I will get there. Each day I still feel myself getting just stronger and stronger, and watching my body change a little bit has been real fun and real interesting. Growing muscle and just continually watching how shirts still fit differently as I'm changing a lot of my collared shirts. I'm probably just going to end up having to get rid of all of them because I can't button the top collar anymore. And those are shirts I've probably had, most of them, for several years. And I'm definitely going to have to just get rid of some of them. I can't button the top button anymore. But really enjoying how a men's dress shirt or a button-up shirt fits me so much better now. And even as far as where my hips are, used to not really button down to the bottom because of my hips, and I'm noticing now that that will button. So I know that there are just some redistribution of my body. And then I was thinking that probably in the last couple months I was having a little bit more acne than normal. So I've been like 5 months back on testosterone from surgery, and definitely noticed this last month was less, but the couple months before that I was noticing that my acne was kind of like it started all over again from restarting the testosterone. So that wasn't fun, but at least it's calmed down a lot now. So that's probably it for changes. Of course, there's always the hair growth and things like that. My face still all right here, and then some in these regions of my face and my mustache are starting to get a little bit darker. So that's just fun to watch. I'll just say that it's really a blessing when you don't have to worry about just being misgendered. So it's almost like once that day comes when you could not worry so much about being misgendered and you could just be, that's probably the best feeling in the entire world. And so it's really nice to just sit back and enjoy all the changes and have a little bit less anxiety about all those types of things. So I guess I'll just show you my chest, and I do have a follow-up visit scheduled next week with Dr. Johnson. I want to talk to him about a couple different things, but this is my chest 5 months post-op, and you know, still my nipples never really became nipples. They're just kind of there, but I feel like my scars are doing really well. I just got a couple, like this is a thicker band here and a little bit thicker there. But I still feel like this area here needs to be addressed. The swelling has never really gone down. I feel like it's kind of poofy, and like this part of my chest like indents a little bit, and I think that's because this really isn't supposed to be there. And then I just feel like this area on me is a little bit more boob-like, I think, than it should be. And so I just want to talk to him about that, see if there's anything that we can do about that. Otherwise, like sensation-wise, I feel like lately, like right around here, I've just been getting some different types of sensations, like, I don't know, it just kind of feels like a little tense at times, a little tingly. So I'm sure things are still just reconnecting and stuff like that. Little pins and needles in my chest sometimes, but all in all, I think it's really good. I have gone swimming a couple of times without a shirt on, and it just feels great. It is a little, it gives me a little anxiety at first, but you know what? I mean, this is like my new reality. I'm gonna have my scars and they're gonna be there for a while. I'm still not going shirtless in the sun, but those were overcast days and when I wasn't really gonna be outside too long. So that's pretty much it. I still notice some muscle growth here and, you know, just some more muscle growth there, which is a whole lot of fun. So it's been great to be back on testosterone and really just start to feel your body really absorb those effects like I did in the beginning. So it was, you know, like 6 weeks off was a little harder on my body than I thought it would be. But there we are. So 5 months post-op, top surgery, and 15 months on testosterone. And that's all I have for you. Thanks for watching. Bye.